As you know, otoscopy is one of the primary methods used for diagnosing patient complaints for the entire ear-nose-throat complex. With a versatile otoscope using fiber optic technology and halogen illumination, you can examine the ear canal and the tympanic membrane accurately and thoroughly. Here's how. Before you insert the otoscope, inspect the pinna and post-auricular skin. Gently palpate the pinna to find out if any tenderness exists. Now, inspect the entrance to the ear canal for any debris or pus which might interfere with the exam. In order to get the largest field of view, always try to choose the largest size speculum which fits comfortably into the patient's ear canal. As a rule of thumb, figure 4 to 5 millimeters for adults, 3 to 4 millimeters for children, and 2.5 to 3 millimeters for infants. You may also want to consider a speculum with a soft distal end for added patient comfort and safety, as well as a snug seal and easier orientation. To make insertion of the speculum easier, you'll need to straighten the outer ear canal. For adults, retract the pinna upwards and backwards. For children, retract the pinna horizontally backwards. Hold the otoscope like a pencil between your thumb and forefinger, with the ulnar aspect of your hand resting firmly but gently against your patient's cheek. This way the otoscope will move in unison with your patient's head if he or she turns or moves, avoiding possible injury to the ear canal. As you conduct the examination, it's normal to adjust the line of sight and the position of the speculum to completely view the entire ear canal in all areas of the tympanic membrane. To help you determine tympanic membrane mobility and recognize many middle ear disorders, sometimes you'll want to use a pneumatic attachment. When you do, make sure you choose a soft spec speculum large enough to fit snugly into the ear canal to establish an airtight seal. Use the same hand position with the bulb of the pneumatic attachment in your palm. By gently squeezing the bulb and observing the relative movements of the tympanic membrane in response, you can obtain vital diagnostic information. As you've seen, although it's one of the most common diagnostic instruments, the otoscope is also one of the most useful. By using it correctly, you'll be able to conduct an accurate and thorough examination every time.